Hi, Dr. Lindsay. I hope you had a great weekend. I figured out my technical difficulties, so here I am with my presentation on emphysema. I'm ready to get started. The definition for emphysema is a condition that gradually damages the air sacs or the alveoli in your lungs, making you progressively shorter of breath. In the beginning stages of emphysema, it may not seem like a very serious condition, but over time you will notice your symptoms worsen and your health deteriorate. Emphysema and chronic bronchitis are the two diseases that make up the category of COPD, which stands for chronic obstructive pulmonary disease. It is called obstructive because over time people with emphysema exhale as if something were to be obstructing their airflow. And then with the picture down here, this is what a normal lung or the air sacs, the alveoli would look like in a healthy lung. And then this is a lung with emphysema. You can tell like the alveoli are damaged and like kind of like shrinking or shriveling up, I should say. And then, like I said before, it's part or emphysema is part of a is one of the two diseases that is part of COPD, one of the most common lung diseases. And like I said before, it makes it difficult to breathe. And also, like I said before, the two main forms of COPD are chronic bronchitis, which involves a long-term cough with mucus and then emphysema, which involves destruction of the lungs over time. Sorry. Okay. For causes of the disease of emphysema, tobacco smoking, because smoking is the leading cause of emphysema simply because of all the carcinogens and harmful substances found in a cigarette or tobacco products. Tobacco smoke destroys lung tissue, which results in the obstruction of airflow, and it causes inflammation and irritation of airways that can add to airflow obstruction. Air pollution is another cause. The pollutants in the air can cause inflammation in your airway, leading to lung tissue destruction. And then another cause would be manufacturing fumes. Manufacturing fumes can cause emphysema because of all the harmful toxins found in those fumes that also destroy lung tissue. Some symptoms of emphysema include constant coughing, which could be also referred to as smoker's cough, shortness of breath, not being able to take a deep breath in, wheezing and tightness in your chest when you do breathe in and out, excess production of mucus in your lungs. Those would all be symptoms of emphysema. Organ that would mostly be affected by emphysema would be your lungs. Over time, the cause of emphysema would cause inflammation in your lungs, which leads to tissue destruction. The lung damage in emphysema creates small air pockets in the lungs where air becomes trapped. With emphysema, the trapped air makes it difficult to blow out forcefully. The more air that becomes trapped, the worse lung function becomes. And then this is kind of a big deal because the lungs are like a vital organ to us because they are a way of respiration, aka getting oxygen in the body and carbon dioxide out of the body. Sorry. The organ function, like I said before, that is associated with emphysema is respiration, is definitely the main system function affected, simply because it gets harder and harder to breathe properly over time. Obviously, emphysema does create air pockets in the lungs. The air becomes trapped soon, which in turn leaves room for fresh air to enter the lungs. Normally, the lungs are spongy and elastic, and over time, emphysema damages the lung tissues, making it harder for you to inhale oxygen. And the thousands of alveoli in your lungs, the fewer amounts of them and the bigger they become, make it harder and harder to draw air into them, and then the less productively they perform. Some short-term consequences of emphysema would be shortness of breath, constant coughing, wheezing and tightness in your chest when you breathe in and out, and excess production of mucus in your lungs. Some long-term consequences would include a collapsed lung. This can be life-threatening in people who have severe emphysema because the function of their lungs are already compromised. Heart problems. Emphysema can increase the pressure in the arteries that connects the heart and lungs. Large holes in the lungs. Some people in emphysema develop empty spaces in the lungs called bullae. Giant bullae can be as large as half the lung, and that would be a problem because nobody wants holes in their lungs. Some treatments would include medication because there's no actual cure for emphysema, but treatments can help relieve symptoms. So medication, bronchodilators, which are drugs, they help relieve coughing, shortness of breath, and breathing. Problems by relaxing and constricted airways. Inhaled steroids, which are corticosteroid drugs inhaled as aerosol sprays. They may help relieve shortness of breath, and antibiotics, because if you develop a bacterial infection like acute bronchitis or pneumonia, antibiotics would be appropriate to help treat that. With treatments continued, there are also therapy options that can help relieve symptoms, including pulmonary rehabilitation, which teaches you breathing techniques, nutrition therapy, and supplemental oxygen, which is where you receive oxygen from a machine. Prevention on emphysema. To prevent emphysema, number one, do not smoke and avoid breathing in secondhand smoke, just because that is the leading cause for emphysema. And then wear a mask to protect your lungs if you do happen to work with chemical dust or fumes, just as an actual, just another way to help protect. Sorry, my thing's not going there. Okay, and then for fact or myth, only smokers. A lot of people say that only smokers get COPD. This is a myth because there are other causes of COPD, which include some progressive forms of asthma, being born without a protein called alpha-1, workplace exposures to gases and fumes, and heavy exposure to secondhand smoke or air pollution. Another myth would be COPD only occurs in older people. It is more common in older people who have smoked for many years, but a simple test can detect early changes from COPD in younger people. And then the last myth would be there's no treatment for COPD. The biggest myth about COPD is that you can't do anything about it. You can stop the progression of COPD by taking medication as directed, getting pulmonary rehabilitation, using oxygen as needed, and then of course stopping smoking.